So you may have figured out that the Medicare Advantage plan you were sold, sometimes the zero premium plan, is not all it's cracked up to be. You may want to go from Medicare Advantage back to original Medicare or original Medicare with a Medicare Supplement. Hi, I'm Christopher Westfall. Been helping people with Medicare plans since 2008, all doing it virtual and all over the phone. We've been doing this model securely for a long time now. What I can tell you is, if done incorrectly, going from Medicare Advantage back to original Medicare can really leave you hanging, and that's with no additional coverage whatsoever. We don't want that to happen. Today in my office, literally, we fixed one of those cases where another agent did things wrong out of the right timing. So I want to walk through the process with you so that you are not left without coverage. Here's how it works. So I mentioned the open enrollment period of Medicare is January 1 through March 31. It's not really open. What it has to do with are people who are on Medicare Advantage plans and they want to get off of the plan that they're currently on. Most people want to go back to original Medicare after discovering that maybe their doctor's no longer in the network that they were sold on, or they found the details in their summary of benefits are not exactly what it was cracked up to be or represented during the annual enrollment period. This happens quite frequently. Happened today in my office, which is what's leading me to make this video. Or you're on a Medicare Advantage plan and it's restrictive and you don't want to stay on that plan, you want to go to a different Medicare Advantage plan. You can do that too during this period of time, but that's not what we're going to talk about. We're talking about people on Medicare Advantage want to go back to original Medicare or Medicare Supplement. Here's how that works. The first step in that process is, if you want a Medicare Supplement, apply for that first. Do that right away. What we need to do is target the first of the month in which you'll make this happen. Usually it's the first of the very next month, and we'll apply for a Medicare Supplement through underwriting to take effect on that day. Why is that? Because underwriters need to look at the record and make sure everything's squared away before approving it. Now, most all the people that we submit through underwriting get approved, and it's no problem. However, every once in a while, there'll be something that comes up and we can't get that person approved right away, so we might need time to go to a second insurance company. Being independent, we do that all the time. If there's something that just doesn't work, we go to a different company. It might cost 25 cents per month more, it might cost $1 more, but we can oftentimes secure coverage where otherwise an agent that works for only one company just would be lost and had nothing to do. So being independent really helps in this regard. But that's why it's the first step, because if you take step 2 and step 3 first, and that is get off the Advantage plan, you may have no plan to back you up on original Medicare. If you're just on original Medicare with no insurance plan, then you have to pay over $1,400 to walk into the hospital and 20% of all outpatient costs with no limit. That's a problem. So what we want to do in most all cases is go to a Medicare Supplement plan from an Advantage plan, and we can help you do that. So again, first, we apply for the coverage through a Medicare Supplement plan. We can do that for you. We've got all the companies, all the states. It takes just a few minutes, and our service doesn't cost you a dime. So it saves you a lot of time and hassle from having to shop all the market, shop all the rates, shop the underwriting criteria. We do that for you all day long from coast to coast, and it doesn't cost anything. So once we get an approval at that Medicare Supplement company, then we execute step number 2. Step number 2 is, if you want a standalone drug plan, which we recommend you get so that you don't have a lifetime penalty for not having had one later, we help you get the Part D drug plan started. And again, that will start on the 1st of the next month from when we applied for it. Once the Part D drug plan starts, that automatically cancels out your Medicare Advantage plan. So again, all of that needs to be targeted on whichever 1st of the month we deem is appropriate based on the timing necessary through underwriting. Again, we can help you with that. It doesn't cost a thing. So again, apply for the health underwriting through the Medicare Supplement company that's appropriate for you based on which plan you feel most comfortable with, and we have all of them. Then and only then apply for the Part D drug plan to get started, thus canceling out automatically the Medicare Advantage. Now, if you don't want a drug plan, you can contact Medicare at 800-633-4227, and Medicare can pull you off of the Advantage plan when you're ready. You could also contact your insurance company. Sometimes those things get lost when you ask them to cancel your Medicare Advantage plan. But again, the timing is critical. It has to happen between January 1 and March 31. So the last effective date for this change to happen is April 1 of any given year. Now, there are 2 other ways you can get off of Medicare Advantage, and they have to do with trial right. And I've got other videos that talk about trial right and how that is implemented. But for Medicare Advantage to Medicare Supplement, don't make the mistake of dropping your plan because you're angry at it, you find out it's not what it's cracked up to be and all that. Don't pull that trigger yet. Because in a worst case scenario, you may be stuck with a Medicare Advantage plan. And if that's the case, you'll want somebody to get you on the best plan for you, which you can still do during this period of time. So for help from Medicare Advantage to Medicare Supplement, my office can help you. You can reach out to us using the form below or by calling us at 800-729-9590. I'm Chris Westfall. Thanks for watching. Oh, and make sure you subscribe to our YouTube channel so we can keep you up to date on changes with Medicare, because they do happen quite frequently. Thanks again for watching.